Hello, everyone. My name is Douchee, and I'm here with Gabby Wimer to talk about the Just Care in the Justice System workshop series led by White Coats for Black Lives. White Coats for Black Lives is a national organization run by medical students committed to dismantling racism and related systems of oppression by simultaneously cultivating means for collective liberation that centers Black people and other people of color. The Columbia chapter applies this model to the communities and healthcare systems we engage with here in New York City. Our current projects consist of the carceral state involved patient care, segregated care by payer status as a proxy for race, the medical curriculum, and research and community engagement. Our team consists of first and second year medical students, an attending physician, and a public health professional. The learning goals of this workshop series are: 1, to train future healthcare providers to be advocates for people who are harassed by the carceral state. 2, request formalized curriculum about the healthcare needs of people involved in the carceral states for all students at Columbia's medical school. And 3, produce workshops that train students on the aforementioned material and demonstrate to Columbia the relevance to anti-racism in healthcare.
The first workshop in our series was Just Care in the Justice System. The learning objectives of this workshop were: 1, to describe justice involvement and the demographics of incarcerated individuals; 2, to identify challenges to patient autonomy, integrity, and privacy for individuals who are justice involved; 3, to interpret available guidance and or lack thereof from state, institutional, and specialty-specific governing bodies regarding the care of justice involved individuals; and 4, to develop tools for advocacy that the healthcare team can use in the context of justice involvement. We were pushed to start this series, and specifically the Just Care in the Justice System workshop, because of the problem of mass incarceration. In the US, 2.3 million people are incarcerated, and even more go in and out of jail every year. In New York State, 190,000 people are behind bars and in inhumane conditions with lack of access to proper health care. As future medical professionals, we will need to know how to care for these patients. But the way things stand now, medical students become accustomed to and reproduce practices of violence, distrust, and abuse to people involved in the carceral state. But we believe that these are patients students should be learning to care for and from. That's where our innovation comes in. Just Care in the Justice System was a student-led teach-in using real cases to prepare learners to care for justice-involved patients. However, given the lack of background knowledge amongst many medical and dental students and other healthcare professionals, we needed to start the presentation with critical background information, such as the difference between jails and prisons. We hosted this workshop in December of 2021 and had over 50 people in attendance, the vast majority of whom were first and second year medical students, but medical faculty also joined as well. The majority of participants indicated on the pre-survey that they strongly believe that it is important for medical and dental students to learn about care for justice-involved patients. However, as our pre-survey indicates, a lot of participants were not familiar with the legal protections for protected health information for individuals in custody. However, after our workshop, the majority of participants said that they were familiar with the legal protections for protected health information for individuals in custody.
So from this teaching series, we learned that student-led initiatives can be essential in bringing vitally important, historically marginalized educational content into university settings. We also learned that students want to learn more about this specific topic, and that teach-ins can provide useful pilot settings for demonstrating interest and feasibility for new curricular content. And so here are some bright spots from our current work. So 1, we've received a faculty seed grant from the Office of the Provost on addressing racism and a call to action, which will be used to create a continued workshop series over the next year. We've begun fostering relationships with grassroots organizations across New York City, including Eyes on You. And we've developed interdisciplinary content, working with people from all over the country, including UC Irvine law professor, Dr. Thompson. So our next steps are to continue expanding our content based on student input and feedback, and incorporate our work into the formal curriculum to ensure that subsequent cohorts of students learn this content. And ultimately, we seek to train a physician workforce who views prisons as obsolete. If you want to collaborate on these efforts, please reach out to us at Columbia, White Coats for Black Lives at gmail.com.